Welcome to Mile High Living. I'm Sam Boyk. Thanks for joining us today. In 2009, the first family-owned and operated American Vein Vascular Clinic opened in Pueblo, and now they are Colorado's largest network of vein clinics. Their vein specialists perform the latest therapies to remedy venous and arterial diseases, and today we have Dr. Paul Rochon joining us to tell us more. It's so great to have you.
Thank you for having me, Sam. Appreciate it.
Absolutely. So first, just start off and tell our viewers a little bit about yourself and your medical background.
Absolutely. My name is Dr. Paul John Rochon. I am originally from Louisiana and have trained in the Midwest as well as in Miami, Florida at Miami Cardiac and Vascular Institute. I am a dual certified vascular interventional radiologist and also diagnostic radiologist.
It's so wonderful. Well, we are talking, of course, about American Vein Vascular Institute, and you guys have a new clinic up in Thornton. Tell us more about it.
Absolutely. Our vascular center in Thornton, Colorado, right off of I-25, is a comprehensive clinic that treats arterial and venous disease, as well as other service lines such as women's health and also pain management.
That's so great. And now break down some of the treatments that, folks out there, if they feel that they need to come and have a consultation, visit you guys, what some of the treatments are that you can provide.
Absolutely. And as you said, we always start off with a consultation, comprehensive management, and some of the treatments that we offer are minimally invasive endovascular treatments for peripheral artery disease. So everything through a pinhole, superficial and venous disease, deep venous disease treatments, women's health, so embolization for uterine fibroids and also pelvic venous disease, and also chronic knee pain.
Oh, okay, great.
Yes.
And you are today here because September is a very specific awareness month for PAD. So can you explain what does PAD stand for and really what is this?
Absolutely. PAD stands for peripheral artery disease. And the reason why we have a month that's dedicated to it for awareness is about 200 million people worldwide are stricken with peripheral artery disease. It is underdiagnosed. About 21 million people in the United States are actually have this particular disease. And with our aging population, it's going to get higher and higher. So that's about 20 to 30% of our population who have peripheral artery disease, but they're not actually being treated like we would like them to be.
Wow, yeah, that is a large number, and especially if they aren't being treated and they do need that. What types of maybe signs or symptoms should people be aware of that they might need to come and get a consultation and see you for PAD?
Absolutely. So it starts off with pain with walking, pain at rest in the legs. We don't want it to get to any ulcerations or wounds in the legs. That we want to try to be more preventive, but those are some symptoms that patients can look out for.
Okay, and probably the first thing would be to give you guys a call to reach out and to schedule that consultation, right? If they do feel like they may be experiencing some of those signs or symptoms.
Absolutely, and patients who specifically have diabetes, patients who have chronic kidney disease, our older population, patients who have hypertension, hyperlipidemia, and patients who actually smoke, and we try to help them out with smoking cessation.
Okay, now if it is discovered that someone has PAD and needs treatment, what does that treatment look like?
So that treatment looks like, again, coming in for a consultation, and that includes non-invasive imaging that we do have in all of our clinics, not just the one in Thornton. So minimally invasive to just check to see where those arteries actually stand. And then if we find that after conservative treatment and medical treatment, if they do need a procedure, then everything is actually through a pinhole. Our patients are sedated with our wonderful patient-centered staff, treated like family, and it's an outpatient procedure, so the patients actually go home the same day.
Oh, that's really great to know. What would that whole process be like to set up and schedule an appointment and then to go in for a treatment as well?
Absolutely. Our patients actually will call our office. They can actually be self-refer themselves or from their primary care physician or other particular physician. They will come into our office, get seen by myself or my nurse practitioner. We will do all of the non-invasive imaging, see if it actually is vascular related. If it's not vascular related, then we try to manage that patient, refer that patient to a specific specialist to actually have their problems treated.
Wonderful. And we are almost out of time, but quickly tell us, what types of insurances do you accept?
We accept all insurances, including Medicare and Medicaid.
Well, that's great to know. So if somebody out there definitely is wanting to maybe check these signs and symptoms, coming to you, getting that consultation, setting up that appointment would definitely be the great place to start.
Absolutely. Thank you.
Yes, Dr. Paul, thank you so much for telling our viewers about this. Now, don't ignore the signs and symptoms of peripheral artery disease, or PAD. Remember that September is PAD Awareness Month, and American Vein Vascular Institute can help. Call them today at 720-617-7333 or visit them at americanvein.com for more information. They paid for today's segment. Stay with us.